Hi everyone, Whitney Lowe, and welcome to today's Clinical Insights video where we're going to be talking about methods of assessment. There's lots of different models out there for how you go about doing assessment, but I want to focus today on one simple model that I find really effective for those of us working in the massage therapy world to try to address various types of soft tissue disorders. We call this the HOPRS method. It's an acronym that's HOPRS. It stands for History, Observation, Palpation, Range of Motion and Resistance Testing, and Special Orthopedic Tests. This is a model that's been in the whole musculoskeletal rehab world for quite some time, and we'll look at each one of those individual sections and look at why it's so relevant and how we can use that in the massage environment. The first section is history, and this is what is the most important part of your assessment process. This is where you're going to ask your client specific questions about what's going on for them, the history of a particular acute injury that they've had, or if it's a chronic condition, how long has it been going on. You're going to go through a group of different questions to inquire about things that are going on with them. The history is so critical because we get a great deal of valuable information if we know how to probe and ask further questions. And this is really the art of good assessment. One of the things that I've found is a lot of people understand the importance of history, or maybe they just do a few little questions here and there, but they don't really probe deeply into what's going on here. And this makes such a difference in being able to get valuable information from your client about what's going on with them. If you know how to take a really good detailed history, you can get so much valuable clinical information that can take you much farther than just any other physical examination methods you might do alone. Now, it's hard to know, how to construct a really good history sometimes, but one of the things that I've found to be really valuable is learning about a lot of different types of soft tissue pain and injury problems. And that's why our courses all focus on this condition-focused approach, because the more you understand about these different conditions, the more you know how to ask good questions that are relevant for what's going on with your client. So take that time, probe deeply, make good eye contact with your client as you're talking to them, express great interest in what they're talking about, and you'll get much more valuable information from that history-taking process. The next section is observation, and in the observation section, this is where we're going to be looking at things that have some kind of visual indicator that might be relevant to a particular pain or pathology problem that's going on with them. This is what you do with your postural evaluations, what you do when you're looking for swelling, redness, discolorations, or anything that might be a visual indicator. Just want to speak for a moment about the whole idea of postural evaluations, because it's gotten a lot of attention in the soft tissue rehab world for the last few decades. I know when I was early on in training, we put a lot of emphasis on trying to get somebody back to meet an ideal postural alignment position. But the more we've learned about posture, the more we've recognized that it doesn't always have to fit into one particular model. And just because someone might have a postural alteration like a lifted shoulder or forward head posture or an anterior pelvic tilt doesn't necessarily mean that there's a problem. So in some instances, it may be a factor, and in others, it's not. So I would say don't put too much emphasis on something if it isn't relevant, but in many instances, there might be something that you'll see that can be a very relevant factor in there. So put it in its proper place, but don't ignore it. The next section is palpation, and this is, of course, where as massage and soft tissue therapists, we really excel in the assessment process because we spend more time working on people and palpating soft tissue than probably anybody else in the healthcare system. So this is where you should really excel with your assessment skills. So during palpation, we're going to feel for tissue inconsistencies or things that might be, feeling indications of fibrous adhesions or structures that might feel like there's something here that shouldn't be, or maybe there's something missing that feels like it should be here, or something with tightness, hypertonicity, or not what feels like knotty structures in the tissues. Those are going to be very important palpatory factors. Now, palpation is very important, but a lot of people, I think, also put too much weight on palpation and ignore other parts of the assessment. Just because you are really good at palpating doesn't mean you can say, well, I'm not going to do any of this other assessment stuff. I just let my hands tell me what to do. That could be relevant. But, for example, your hands can't tell you what's going on with a nerve entrapment problem because you need to know the signs and symptoms that are indicative of that and try to identify where that's coming from. You just can't do that through a palpation appropriately. The next section, or R, in our HOPRS protocol is range of motion and resistance testing. This is where we will perform active motions, passive motions, and manual resistive tests. Those three key types of testing indicators are very important. Now, what's most important about these is that you understand how to identify and recognize the patterns that come out of them. So for example, when we do an active range of motion test in a certain joint region, we want to determine if there's pain or discomfort in that movement, where that occurs through the range, what area of the body or limb that's occurring in, and is it constant? Is it the same pain that that client has been experiencing? Those are all going to be very important factors to identify. We'll do the same things when we evaluate passive motion and the resisted motion, where we're trying to engage a muscle contraction but not allow any movement to occur. This is a really crucial factor to look at all three of these, because it's the results from these different tests that we will combine together to look at the patterns that emerge. So if there's pain with a certain motion actively, it's not present passively, but there's pain with a manual resistive test, that's a pattern that would tend to indicate a particular type of tissue complaint. So the more we recognize those ideal patterns, the better we'll get at narrowing down what's going on with the soft tissue involvement there. Now, the last section of our HOPRS procedure is special orthopedic tests. And this is where, if you've ever looked at any orthopedic assessment books, you'll see there's just hundreds and hundreds of these special orthopedic tests that are used to identify or draw conclusions or narrow down the likelihood of a particular pain condition or pathology being present. Now, one of the things that we've begun to investigate a lot in recent years is how accurate are these special tests at actually picking up or identifying certain types of problems. And what we found is some of them are really accurate and others are not very accurate at all. So just because there exists a special orthopedic test doesn't mean it's necessarily a good one. And a lot of people tend to get really overwhelmed with the idea that they have to memorize all these hundreds of orthopedic tests. And I'm telling you, you don't. Especially now, there's so many resources out there in books and great videos that are on YouTube or on the web. Lots of different places that you can go back and refresh yourself how to perform that particular procedure if you want to learn how to do it. But again, a lot of people also put too much emphasis on these special tests and say, well, that's what when I'm doing my assessments, and they'll use a plural referring to special orthopedic tests only and not talking about the other components that we just mentioned being really important. So those tests have a place. I've begun to put a lot less emphasis on them than I used to put on them years ago, because I've really found a lot more value in the other portions of that assessment process and putting together a comprehensive clinical picture about what's going on for my client. So this is just one method or a model of assessment, the HOPRS procedure that we've introduced. There are lots of other ones out there that you can use. The key is if you have some kind of structured and organized format to put your information in and to sort of give you a framework for your investigations with your client, it's going to help you be a lot more efficient and effective in gathering information from the client. So what we're looking to do is find a system that works well and then put it into practice, and then know that the assessment is going to drive our treatment decisions that are coming after that. So thanks very much for watching, and be sure to like and subscribe to the video so you can keep up to date with other things that we have going on here. And if you want to delve into some of these clinical resources in greater detail, come on over and visit our site at the academyofclinicalmassage.com, where you can learn all about all kinds of other aspects related to massage and soft tissue treatment for a variety of pain and injury conditions. All right, we'll see you in the next video.